Well, more now on our breaking news this evening that 100 leading doctors have accused the government of damaging the health service in a letter to The Guardian. They say coalition cuts have weakened the NHS. Well, one of those who signed the letter is Dr. Clare Gerada, who joins us now. Welcome to you.
Good evening.
Who organised this letter?
Myself and some colleagues organised, some medical colleagues organised it.
And it's basically a Vote Labour letter, is it?
No, it isn't a Vote Labour. It's certainly not. It's highlighting the problems associated with this government's handling of the NHS. It's up to the electorate to decide what they vote, but it's actually pointing out that the NHS has suffered considerably over the last 5 years. And if it continues in the direction that it is, we probably won't have an NHS that's free at the point of use and comprehensive.
Do you think the NHS would have suffered any better or not suffered so much under a Labour government when I'm sure the Tories would be the first to say we're the ones who protected the spending, they would have cut it?
5 years ago, the NHS was performing as the top health service in the world. It had the best health outcomes, the most equitable health service, the best value for money. You certainly can't say that's the case today. We now have, as we've heard in the news today, queues for general practice, which I'm a GP, queues for the emergency department. We have, at the moment, the NHS is withering away, closure of maternity departments, walk-in clinics, A&E departments.
But it is one of the few areas of government spending over the last 5 years where spending has been maintained in real terms.
What you have to do to maintain a health service is actually have what's called health inflation, because the cost of delivering healthcare...
But you have to have the money in the first place, don't you? And everyone else has seen cuts, the health service hasn't, and yet you're just saying you need more money.
The health service has made a number of cuts.
But also the point is Labour wouldn't have found that money. They announced their plans.
I'm not here to speak for or against Labour, for or against the Conservative government.
You are. I mean, the letter is an attack on the coalition's handling of the health service.
And isn't it sad that when one talks about the health service now, it becomes a party political issue?
Oh, come on, it's an election campaign. This is an election letter which has been done in that context.
The NHS has always been a political issue.
This is just a discussion document.
It isn't a discussion document, but it's actually laying out...
It's designed to make people think how they're going to vote, isn't it?
It's important that people think about how they're going to vote with respect to the NHS. It's important that they understand what's going on in the NHS, what's going on with the privatisation.
So it is something that is designed to campaign against the coalition?
As far as I'm concerned, if people read that, yes, then that's if you say, but in fact the letter is there to lay out the problems we're seeing with our national health service.
How many of the people in the letter are Labour members?
I have no idea.
Are you a Labour Party member?
I am a Labour Party member, yes.
But
I'm not a Labour Party activist. I'm certainly not standing as a politician.
But you were one of the organisers of this?
Yes.
Exactly.
So I was organising.
I mean, what the Conservatives already say
my
tonight.
views about the health service predated my membership of the Labour Party.
But you agree that this is weaponising the health service?
I hate that word. When I was chair,
Ed Miliband's word. It's not my word.
When I was chair of the Royal College of GPs, I was not a member of the Labour Party. My views then are identical to how they are now.
The difference is you joined the Labour Party.
This government has presided over the dismantling, the fragmentation and the cut of the National Health Service. We now have a crisis not just in A&E, but a crisis in general practice.
I think it is the case, is it not, in A&E, as far as the 4-hour wait is concerned, that the NHS is still performing, by global comparison, extremely well.
It's remarkable how the good people who work in the NHS have kept it together, but they're keeping it together with sellotape and brown paper.
But that's because there's an economic crisis.
The NHS is being kept together by the goodwill of people like me who go and do way over. It is not being kept together
other than giving you real terms medical inflation money, which seems to be not tenable unless we're all going to pay 80%, 90% tax. Other than that, what is this government done wrong that Labour would not have done?
It accelerated the market. The market, by anybody's, if you take the
increase from 4% to 6%.
If you look at the costs of running the market currently, government figures are between £5 and £10 billion. If you work in the health service, as I do, every single day, including yesterday, what you see is a fragmented, chaotic health service where patients are now having to queue for longer. Now, I had this when I was first started in general.
But it's still performing very well.
Well, we'll see. Well,
and the spending has been protected, has it not?
It isn't performing very well at all. You ask the satisfaction rate. It is beginning to drop, but what's holding up is the satisfaction rate. What we will see, if this continues though, is we will see, and it will happen because it happens in many marketised health services, is a rapid drop in satisfaction. The poor will suffer.
Do you think 6% is marketised? I mean, 94% is not marketised.
I don't understand the question. I'm not an economist. I'm here as
you're making assertions, and I'm just saying that only 6% of the NHS is privatised.
No, it's considerably more than that. If you include the PFI, the cost of it, the private financial initiatives of the building.
Which was a Labour initiative.
I'm not here as a Labour Party spokesman.
But you are.
I'm a Labour Party member.
In an election
I'm not here as
saying this government has run the NHS into the ground.
Can I finish answering your question? If you take into account all the outsourced jobs now, a lot of the portering, the catering, the transport for the NHS, it is significantly more than 6% of the NHS has been privatised.
So you think that the catering, for example, should be nationalised?
I was just answering your question. There's a lot. I think the catering of the NHS should be nationalised? I think we should have a long, hard look at what the cost has been of the marketisation, the privatisation, the denationalisation.
Which you would accept, from your long experience in the NHS, has been introduced by successive governments of either colour.
Of course it has. This is not party political. Of course it has. In fact, PFI was accelerated by the last Labour government. It was begun by the previous Tory government. So of course.